An EpiPen. You've heard of it before. Without insurance, it costs about $200, but here it costs $25. This is a pharmacy that folks in Winston-Salem desperately need. Today, I met a woman who is on the front line helping to solve this city's biggest healthcare problem. Dr. Raven Scales is a pharmacy director at United Health Center's pharmacy in Winston-Salem.
When I found out I had the job, I spent the whole night crying, like tears of joy.
Scales says she felt like she beat the odds. She says she didn't expect to be in a position like this.
My last year in pharmacy school, there's like this big conference you go to do interviews to try to see if you want a residency or a fellowship. And I had interviews and things lined up, and I didn't get any. I didn't get a residency, I didn't get a fellowship.
Scales says her journey didn't start out as she wanted, but learned every step was exactly what she needed. First as an intern at Rite Aid, and eventually a Walgreens pharmacy manager before landing the job at this newly established pharmacy.
There are thousands in this community that have poor health literacy, don't have transportation, just a lot of barriers, don't have the funds to be able to afford doctor's visits or their medications.
Scales wanted to bridge the healthcare gap.
Patients who come in and they see our doctors, they have access to these medications that are more affordable. So for example, for Januvia, we have a 90-day supply for $45. It's probably $1,500 for without insurance.
But Scales says you have to live it to really understand.
And I'm just a prime example of someone who may have needed a pharmacy like this. So being able to relate and connect to the people in this community, like my family members are in this community, my friends, friends of friends, friends of family, just being able to understand where they are and then being able to bring them where I am.
Scales wakes up every morning, oh, so grateful.
I had my moments where I thought God forgot about me, but had I went that route, I would not be here now.